On behalf of the SAEM Palliative Medicine Interest Group, Dr. Karen Jabaniak, we'd like to welcome all of you for what is going to hopefully be the first of 4 palliative medicine webinars specifically designed around developing a toolkit. This is my plug, though, that if you're on this meeting tonight or have interest in this topic, we would love for you to join our palliative medicine interest group community within SAEM. I'll introduce myself. My name is Satish Ganaga. I am a emergency medicine physician based out of the Henry Ford Health System and specifically Henry Ford Wyandotte Hospital in Southeast Michigan. I am a physician, site medical director of a freestanding emergency department in my health system. I'm an ED clinical researcher, and really, I'm passionate about this topic and specifically the intersection of where emergency medicine meets end of life care, palliative care, and opportunities. This session today is the first of what will hope to be 4 webinars that we're describing as the Palliative Medicine Webinar and Toolkit series. I want to thank the Society for Academic Emergency Medicine because our interest group was given a small support grant to pull off this webinar and then later the output that we hope to generate. And so this is the deliverables that we hope to create for you all over the next 6 to 8 months. But this webinar series and toolkit was specifically designed to try to enhance primary palliative care skills among emergency medicine students, residents, and even experienced attending physicians. What we hope to do is record 4 of these sessions. They're each an hour long, but we're really trying to keep our lecture short, about 20 to 25 minutes max. And we will have a QA session here today, but ultimately we hope to generate 8 separate short videos that will also have an associated one-page summary sheet or resource. So our hope would be that when this is all said and done on the SAEM website, we'll have 8 really short videos that could maybe be played at didactics, as well as 8 one-page summaries that complemented the videos that could kind of help the learner advance whatever we were discussing. So we really hope that this toolkit will be valuable, not only within our own EM palliative community, but just generally within the emergency medicine community. These are our initially planned topics and faculty. Karen and I are going to start it out with really core basic lectures. I'm going to talk about the why, like why is this important? Why do we want to incorporate these skills into our practice? And Karen's going to give just a sneak peek today on the how. But the how is really complex. And we have other lecturers covering, Dr. Naomi George, who's going to be discussing how we screen or identify patients with unmet palliative needs. Dr. Rita Manfredi trying to teach us tips and tricks around how to do focused, really meaningful goals of care discussions. We have Dr. Sean Liu in the future talking about specific geriatric opportunities and where palliative and the geriatric ED guidelines intersect. Dr. Daniel Markwelter has got a wonderful lecture around tips. I'm going to maybe give another lecture around prognostication and survival curves and how to harness that information to help families make decisions. And then Dr. Daniel Baran is going to give a lecture in the future around how to incorporate these concepts into your own residencies or didactics or curriculum. So those are our initial 8 lectures that we hope. Some of them don't know that they're doing these lectures yet, but they're going to be doing them. They have a really supportive group. And then what we hope to do is generate one-pagers that might look like this: how to break bad news in the ED, a focused ED code status conversation guide, something that you could share with your resident or your medical students after watching a video like this.